there, my name is Gabby Garcia, and for my article, I did the role of an infant mother bond in neonatal abstinence syndrome, NAS. So, this article really is about how the use of non-pharmacological means of implementing like kangaroo care, having the baby lay just with the diaper onto the mom's chest, or even using acupuncture therapy or breastfeeding, how this can aid the attachments between the mother and the baby during this critical time in which the baby is in an ICU. And this plays a huge role on us because going to university, we have found a lot of mothers and a lot of babies that did take opioids around that time, and a lot of babies showed the effects, the effects of shakiness, high-pitched crying. So all of these side effects of the baby were shown within this article. So they first started off with some statistics saying that there has been an increase in amount of opioid-induced incidents with babies over time, and this both includes alcohol, or this includes the use of barbiturates or benzodiazepines, all of those types of drugs. And really we're trying to find a way to the most positive way of not incorporating just methadone alone to treat the abstinence, but really to focus on an overall holistic care for the mom and baby to promote this bonding. So what the article focused on was that it's called the attachment theory. So really what our main goal is to treat the baby's NAS symptoms, right? And that's through pharmacological means. But really, they said that during this critical period of time, the mother and the baby are not going to be able to bond as effectively. And this is important because theories show that babies are predispositioned to learn cues like for nursing or for attachment or for loving by crying and having that crucial bond with their mom within the first stages of life. So if the baby is in the ICU or being cared for or under treatment, this mom is not going to be able to have the time with the baby. So this is why this particular attachment can be extremely interrupted, and if this attachment is interrupted, then it can lead to neurological disorders later on. It was saying that there's an imbalance with dopamine, serotonin, and norepinephrine that can lead to mental disorders later on. So this is why that we want to stress the importance of doing non-pharmacological means to help babies be able to build this attachment to, one, to treat the NAS symptoms that are going on, and two, overall have developed that attachment theory, the attachment conditioning that babies develop during that particular time. So they found overall with the use of kangaroo care, with the use of acupuncture with the mom for treatment, it's like holistic means. They use breastfeeding too. Breastfeeding really helped. Rooming in as well. We learned about the importance of rooming in to help with NAS baby to promote bonding. It really helped here. We have found that rooming in with the mom and the baby decreased the amount of crying and symptoms shown with NAS babies dramatically compared to if they were in ICU. So I thought that was really interesting. Also, and yeah, those were all of the interventions that they use, and even at home interventions too, making sure that the mom is having an adequate attachment with the baby and everything. And they have found that with combination with pharmacologic interventions, there is an increased amount of bonding, a decrease in amount of the NAS symptoms experience overall, just by combining holistic means along with treating the opioid treating the opioid withdrawal as a whole. So I thought this was really good because it kind of reflects to us as nurses on how we're supposed to treat the holistic person, because our job is not to focus on the condition itself, but to treat the person as a whole. And this is a good representation of that, on how allowing the mom to be involved with the treatments, allowing the mom to like intervene with non-pharmacological care to promote the bonding with the child and the mother, with the baby and the mom, really helps overall as a whole. And thank you so much for your time.